extremely important for us to start awareness campaigns in India on World Heart Day, as it has been started by the World Heart Federation all over the world. And this will help us address this huge burden of non-communicable diseases, NCDs, which is rising because of CVD as a leading cause of death. Of 30% of death is coming from cardiovascular diseases. So recently it has been noticed that there has been significant increase in the cardiac cases, especially the premature cardiac cases. So yeah, by premature, what I mean is the cardiac CVD diseases below the age of 70. So below the age of 70, it is considered premature death, and this causes a lot of trouble not only to the families involved but also to the country overall. As there is research done by the World Economic Forum that the premature death also leads to a fall in the GDP productivity of the country. So even if we go with Make in India and we want to be a $5 trillion economy, but if you're not a healthy economy, so there is no use of that increase in GDP and becoming a $5 trillion economy. So it is also very important to maintain the health of the people. And World Heart Foundation is doing that, and they are encouraging the leaders of the countries, the political leaders, the ministers, the health ministers, to make cardiac health a part of the agenda of the government to reduce this economic burden and emotional burden which is created by CVDs all over the world, and especially in India. And recently, we have seen that CVD has affected not only people who are living an unhealthy lifestyle, but also it has been surprisingly seen in sports people, in doctors, in actors, in entrepreneurs, all below the age of 70. For example, there was one of the well-renowned cardiologists in Gujarat, Dr. Nishit Chandra, who passed away from a heart attack himself, raising the health issues even in medical professionals as they go or undergo a lot of stress due to the high workload, and they have to conduct multiple surgeries and work for long hours because of the long hours required because there's so much patient workload. Then Siddharth Shukla was a popular TV actor in Big Boss 13, and he passed away at the age of 40 due to a heart attack. Then there was Raju Srivastava, a very famous comedian. He also died actually while working out in the gym, and he was a health conscious person. And the list goes on and on. Like Raj Kaushal, a film director, he died at the age of 49. And like that, there are many, many other examples which are shocking because we are reading and seeing them in the news nowadays. So the first thing we would like to discuss with Dr. Mehta was, with 20 lakh deaths happening in India, which is 30% of the leading cause of death in India, what do you think is the key factor? Like suddenly there's a big rise in cardiac cases, or is it that it is being noticed more right now, or what is the leading to this rise?
See, I feel that cardiac cause has always been the leading cause of death, even more than I think cancer patients, more than cancer being the cause of death. I think cardiac is the major cause. But yes, definitely with after COVID, it has been seen that there's been rise in cardiovascular diseases, plus even young deaths have been happening, which may initially or which earlier, which were not being, seen or recorded. So this deaths happening at an early age, I feel is due to COVID has a strong role to play in this because the virus had certain effects on the cardiac muscle, cardiomyopathies have been happening, and because of that, people or young people have become prone to cardiovascular diseases, and sometimes they don't even realize that they are having because they have mild symptoms and they don't take that seriously, they feel that it's mainly gastritis or maybe it could be some kind of uneasiness. So that's what leads to sudden deaths, and people are not even aware that they had certain cardiac disorders going inside their body. So that's what I feel, that here comes the role of prevention. That is, prevention is better than cure, I say. That we all know that is a famous saying, right? So how can we prevent these cardiac disorders? So the first step is, I think the first role comes here, the lab comes into play. That is the first place where a patient goes or a person goes for a routine testing. So there is the first step where we can start the preventive measures.
Right. So you're actually quite right because you're right. Prevention is always better than cure. Right. The stitch in time saves nine. Right. Interestingly, this is also not only by supported by data also. Right. So 50% of the premature deaths by CVD are actually preventable. Right. Sorry, not 50. 80% of deaths. 80% of deaths are by which are premature. Right. Before the age of 70 are actually preventable, which are required because, and especially in a country like India, right? So in India, as per the research done, 50% of cardiovascular patients are not even aware that they have CVD disease, right? So first step is the awareness of this 50% of the population who is not even aware they have a disease, and that's why they called it a ticking time bomb. And all of a sudden, they might get a heart attack, and we feel like, oh, it has sudden heart attack, but no, there was past history which was undiagnosed, right? And that is 50% of the population, and the remaining 40% of the population
Ah, right, right.
can still be the deaths can still be prevented through lifestyle changes and the right healthy oil options and or medication also. Right. So, like we can see this, right? 80% of deaths are preventable, which are premature. So, being a clinician, what do you feel labs can do to educating patients about managing their diets, exercise, stress levels related to cardiovascular disease? Because quite often it is the labs in the neighborhood that have a very close relationship, I've seen, with the patients, and they have grown up and the patients have a lot of trust factor with them compared to the big chain labs where there's just one person there, phlebotomist, who's collecting the blood sample, and versus a pathologist lab or a lab run by someone who has been in that area for last 20 years. They have an extremely close relationship with the patients. I've seen that. So what role can the labs play, because they are the very first point of contact for a lot of these patients and also for the clinicians who are working in that area for a long time. Like we have seen, we celebrate Father's Day, we celebrate Mother's Day, we celebrate Valentine's Day. However, like this very important part of life, which is the heart, also we should be celebrating, like where we take care of it and we diagnose the patients, which can lead to other reducing the deaths and the preventable deaths. So, what do you feel the role of these labs can be, especially the neighborhood labs who have a very close relation connection with the patients and the clinicians and the GPs?
So I feel when a patient, in my clinical practice, I feel many patients come to me and they've already got their test done. I mean, I don't even recommend them those tests, and they are with their all, like, they have got full body profile done, and they come with all the investigations that yes, we have got these done. So even I think before the doctor, labs have a major role to play, because patient first steps into a lab, get his test done, and then comes to a clinician. Yes, I think I have this problem. So at that very point, when the patient comes to a lab, and I mean the lab people, they get the test done, and if they feel some kind of tests are not in the normal limit, or especially like lipid profiles, these are the major predisposing factors for cardiovascular diseases like cholesterol levels, VLDLs, triglycerides. These are the various lipid profiles we measure. So if they are not in their normal levels, even other tests they get it done, like thyroid profile, CBC, diabetes, blood sugar levels, anything they feel is not within the normal range. So they at that very step they should start educating the patient. Like, I mean, I'm sure in labs we have certain technicians, certain nursing staffs who are educated, and so they can actually I mean, educate patients, especially people from rural areas who are not aware what is happening and what is wrong with their tests. So that what is wrong with this test, and what kind of effects it will have later on, or maybe in few months on their body. How bad is the lipid profile, and how can it affect and their cardiac health, and why immediately they should seek medical help or medical advice. So at that very point, I think the labs have a role to play, educating the patient. Then even, patients who are coming to you and you feel that you can even at lab, people can even educate them about the preventive measures they can take, how they can prevent further progression of the disease, or how exercise is important, the right kind of diet is important, and what kind of workout they require, like how many minutes of exercise. All these kind of basic things can be, people can be educated through the labs as well. Then they should be advised that going to the right physician or the cardiologist or a physician for the further workup and further treatment.
Right. You're absolutely right. It's about creating the awareness, and I've seen there are these cake shops, right? On Father's Day, Mother's Day, they are making the cakes and gift cards, which are celebrated and in an unhealthy way. So why not? I think the lab should start celebrating World Heart Day and make gift cards for lipid profile test, and those can be used because a lot of times people don't want to go to the labs. They are afraid of going to the labs, or they feel it is too expensive. So why not create a lipid profile gift card and give it to your parents or near and loved ones, and you might just end up saving a life or so, right? We spend 500,000 rupees on like these other days, but not on one of the most important days, which is our World Heart Day. So I think labs can create awareness, like what you have said, and go with just like how other days are celebrated by gift shops like Archie's, like Father's Day, Mother's Day. Labs should also celebrate World Heart Day and take health seriously for the patients that they're serving and help to diagnose this 50% of our country's population that is undiagnosed. So that will really help a lot, and creating awareness. So putting up posters in the lab of World Heart Day, giving special to encourage people to come on World Heart Day. For example, we at Accurex are offering 55% special price only for World Heart Day because we believe that this is the time, we can join the World Heart Federation, create awareness, and this is the right time to create awareness about. So we are passing on similar kind of awareness programs to our pathology lab customers, and I feel if they can do a similar thing like create gift cards for the children to give to their parents or to their near and loved ones, and also create special offers to encourage patients to come to the labs, or even do a health awareness camps. So health awareness camps have been very successful in large countries, and especially in India. If you look at all the examples of the highly successful healthcare companies, hospitals, or chains, they have been through camps because, as I said, 50% of the people are undiagnosed. So that's how the people who are undiagnosed, they are getting diagnosed through the screening camps. And that's a great way to increase awareness on World Heart Day by conducting screening campaigns. So those are some of the things that can be done. So now coming to like what you said about the rural population. So like it's a well-known fact that 60% of India lives in rural areas, and 70% of the healthcare infrastructure is in the urban areas, the metros, right? And this is a big mismatch. This is a big problem which is there in our country. So there are some hospitals which are catering to this population. As like when you go to AIMS Delhi, also you see that people are living outside AIMS Delhi because they're coming from all over India and getting themselves treated there. So a lot of times when the rural population goes to an urban center to get treatment, they are lose their wage for a day and they have to get the treatment and come back on the same day for an OPD treatment, and they cannot stay there for another day, and they're traveling 50 to 100 kilometers on average to go see a doctor because 70% of the infrastructure is in the urban areas, and they cannot wait another day or afford to wait another day for the lab report to come out and then go back to the doctor, take the treatment again. So this is a very big issue in the rural areas. And why? And if the diagnosis can itself happen in the rural areas, it would help a lot, and the patient can go see the doctor after getting diagnosed, or if they go to the urban areas, they get diagnosed and they can go back home on the same maybe in the same hour also, not even the same day. So this gap can be bridged by point of care testing, and this is interesting because now there are lipid meters which are available in the market and are being used for a similar use case, but they're not really popular yet. They have not been caught up yet, and there's a lot of doubt also in the mind of the clinicians, like, like, will it work, will it not work? However, like, they are being used heavily in developed countries like US, Europe. A lot of times they just become the norm, right? But here in India, they're still not really picked up. So what would be your suggestion, for this point of care testing to pick up for the rural areas, and how can it be adapted for our country?
Yeah, so like you said, I mean, it's a very great initiative by Accurex. They're offering 55% off on the tests, I mean, especially in World Heart Day. So similarly, I feel that we could conduct certain kind of, screening camps at the rural areas where this point of care testing can be done. So immediately their like set of patient comes. I mean, you can just, tie up, especially lab people can tie up with some local bodies like panchayats and village heads, and those people, a camp can be arranged for those people, and they just have to get the test done immediately. You can know exactly that yes, they are at a risk of developing a heart disease or cardiovascular disease, and immediately they should be shifted to a better center or hospital for further evaluation and further management. So this is one way out, I think, where rural people can be catered to by like create like doing regular camps, maybe maybe a 6 monthly camp at rural areas in periphery areas,
Hmm.
and those people can be reached to. And rest, I
Right.
mean, encouraging those people further on, and educating them again about what problems they are going to encounter with these high lipid profiles or high cholesterol, and what further management should be done. So they should be educated at that level. And even certain, like you said, like in my metros and in urban areas, hospitals are conducting various kind of activities, like maybe some uh, webinars, Zumba. And one of this activity today, which is being conducted by Accurex, is again an awareness program and awareness campaign for everybody that why heart health is important. So doing these kind of activities at rural areas, in like we can have certain skits and certain plays where, in their local language, where people in vernacular language, so that they know what we are talking about and what disease are we discussing. So I think
Hmm.
this is one way out where rural people can be reached and they can be educated about it.
Yeah, that's a very good idea. The skits and plays, and that's being for it started off with NACO first with for HIV awareness, and it was extremely successful because that's what our rural connects with, the skits and plays, and because of that, a lot of the HIV awareness was created in rural India, and it has the burden has come down. So I think skits and plays is the way to go, and interesting lot of CSR activities being done in this area. So a lot of corporate social responsibility funds are venturing into rural area for healthcare screening, where they take an entire bus with the doctor and they go use the point of care testing, and the doctor gives the treatment, and it's like a mobile doctor clinic, and then they go from one village to another village to another village. So a lot of these innovative models, like using skits, using a mobile clinic with point of care testing, will help in the long run. And it has to be innovation driven. We cannot keep doing the same thing that we're doing and expect different results, because we are not getting results. We can see the burden of cardiovascular disease is going up, and it's going to continue to go up unless there are some changes being made at the government level. But we cannot just keep waiting for the government to make changes. We also have to be the change, and we can also take up activities like promotion of healthy heart on World Heart Day. So that's a good way to cater to the remaining 60% of our population who doesn't have access to healthcare infrastructure. And coming back to, a test is 70% of the decision in medicine practice, right? So from the time of if a patient should be admitted to the discharge of a patient or the therapy to the patient, 70% of the times it is as per the research conducted. It depends on a diagnostic test, and the remaining 30% is empirical study of the doctor. And interesting that it is only 2% of the healthcare cost if you look at the total thing, right? So prevention is always better than cure. So that's the reason it is only 2% of the healthcare cost, because it is so much more economical, cheaper to get diagnosed and treated than to go into sick care. Like when you are sick and getting admitted into one hospital or so. So the quality of the diagnostic result plays a very important role, because 70% of the decisions are based on the diagnostic report. And coming to lipid profile testing, it is extremely important because there are a lot of interferences which happen in lipid profile testing of different other parameters, right? Like if it's a lipemic sample or if it's a icteric sample, and many other also interferences which can happen in lipid profile testing. And there are a variety of reagents available for a lab, and how does a lab decide like which is the best reagent, right? Which is the reagent that they should use when it comes to lipid profile testing, as it is one of the most expensive profile test. Like when you compare a lipid profile to a kidney profile test or a liver profile test, it is very expensive. So it is very important that the lab uses the right reagent to get the accurate and precise reports, because the decision of the clinician like you will depend on that report. So for this, it is extremely difficult for a lab to decide how do we, because everyone is approved by Indian FDA. That's why they are able to sell the product in India market. But what is the difference between all these companies? So in the medical fraternity or medical world, like I've seen, a lot depends on the research papers, right? Especially international published research papers, which have peer reviewed also, which are third party peer reviewed research papers. So just for the clarity of our audience, right? Can you, since you are also have published a lot of research papers, can you just throw some light on like what is the importance of a research paper, versus say a study carried out in-house, or a study carried
See, in
out by
research.
one person, an independent study paper carried out in a research paper, like how is it different, and like how difficult is it to publish a research paper, and what is the peer review? Like we have heard of this word peer review, but a lot of people are not clear about what it means. So as you have published so many papers, can you explain the process a little bit?
Once you're publishing a paper, if you're publishing in a very good journal, there are many parameters required. So one is the ethical clearance. Once you're doing a research on some subject, so you need a ethical clearance. You need to do a Helsinki declaration. So then only you can go forward with the study. So that is talking about a case control study or a randomized control study or a clinical trial, right? But when
Right,
you and the studies where we kind of analyze many other studies together, we analyze like two, three things together, and then we decide on that this is the way, that is more of a meta-analysis. It's called meta-analysis. Like
right,
we decide, okay, yeah, this study is the most accurate study. We even do that kind of study. That is, we take 5, 10 studies, and then we find out, no, this study is the most accurate study. So I feel the ones which have been the studies which are PubMed indexed are very they are very, they have right results, and they have a better, you can say, reliability when they are PubMed
right.
indexed. So one of the studies which I've I think gone through is the Greg Miller study, which has been done for lipid profile testing, and in which they have used various reagents. They have just kind of compared different reagents, and which have been the best ones to for doing the HDL and LDL estimation. So in this study, there was being mentioned about the CQC reagent, where they were used direct reagents, and that led to the confirmation of the HDL and LDL, and estimation of, there were less error in the estimation of HDL and LDL. So I feel that because this study is a reliable study, because again, I told you it's a PubMed index study, is more reliable. And because and plus, they have gone through so many reviewers. They have to, when they're PubMed index, which they publish the studies, they have a lot many reviewers which check the reliability. What they've done
Can you
is,
explain a little bit more about what is this reviewers, what is peer review, like for
reviewers are
our
like
audience?
those people, so once you send your study for publication, so they don't just publish it immediately. They don't go for they don't publish a
Mm,
study just in one go and you say, oh, it's all right. So they have to, for the study, they do the first the editing part. They make you do the editing part. Just go through the
mm.
study and they say, okay, these are the errors you have, these are the grammatical errors, and then next comes your what the data you have presented to them. The statistical analysis you have done, whether this is right or whether this is wrong, whether there is some corrections required, or they feel that the data is not right, then there is a plagiarism check, that whether you're not just copying results
Right.
and copying your thing from other studies. So these are various levels of checks are being done, and all the reviewers, like there are 2-3 reviewers, they will comment, they feel that certain
Hmm.
things are there which are not right in the study. Then you have to, when you have to have a discussion with them, you tell them, no, this is the way it is, that is why we have published these results. Or sometimes they have certain queries, you have to answer to those queries, and then after like 4 or 5 of these question and answer sessions happening with them, and then they go for further, then they approve the study. Yes, okay, we find the study to be reliable, we find the results to be okay, the methods have been fine, and the ethical team has been taken care of, and then they go and further publish the data which you have presented to them. This is how it
Right,
happens.
right. So it's a very complicated and a lot of reviewers are involved in it, right? It's just not the author or the researcher who's publishing the paper, but there's also reviewers involved checking the data, the statistical part of it. So I think a lot of the labs, when they have to decide between different kind of products, like which product to go for, because it can be really confusing, like which is the most accurate, which is the most precise product to select. I think it's very important that they look at all research papers, because the research papers are written from a neutral third party point of view. And it could be about lipid, it could be about kidney profile, liver profile, any of the research which is done on the products to check the performance of both the non-diseased and the diseased states. Because in the non-diseased states, the total errors will be lower, but in the disease states, the total errors generally try to tend to be higher because of the different interferences that are happening. So as you can see in the lipid profile testing, there were seven different companies test evaluated by Dr. Greg in the US, and he published this paper in AACC, which is the number one body in the world for biochemistry, American Association of Clinical Chemistry, and they also set up the reference ranges, guidelines for everything related to diagnostics. So a lot of the COVID guidelines world over were actually being given by ACC. And this paper was published in the American Association of Clinical Chemistry Journal by of Dr. Craig Miller, and it clearly looked at all the top seven reagents for lipid profile testing, and it found very interesting that in the non-diseased patients, the total error criteria was met by all the kits. So all the seven companies met the criteria for the non-diseased, but in the diseased patients, only Sekisui and Roche met the total error criteria. So Sekisui is a Japanese company, and most of us must have heard about Roche, which is a Swiss company based in Switzerland. So the only companies that met the criteria for the disease patients was Sekisui and Roche. However, Roche showed a negative and positive bias greater than that of Sekisui. So even though both met it, Roche showed a greater positive and negative bias. And this clearly demonstrated that Sekisui was the reagent kit that performed the best for HPL diagnostic method for diseased patients. So, like any research paper, this validates that using the Sekisui reagent, which we are distributing in India from Japan, is the best one to give accurate and precise reports to your patients. So, not only for lipid, but for laboratories looking at any product, be it the instruments, be it HPLC, always look for the research paper which is done independent, not by one person, but is reviewed by multiple people and published in an international journal, if not a national journal. And that will give you much more confidence in selecting the right product for the patient. So that is about the test for this lipid profile. And then I would just like to end by adding another question on the high risk patients, right? So, given that many high risk patients, especially with abnormal lipid profiles, are missed in screenings, so how labs can uh, do better screening so that some patients are not missed in cholesterol testing while doing the lipid profile testing to better identify these individuals?
First of all, I feel like every individual after the age of 40, at least, I would say now recommend everybody to go for a lipid profile testing. I mean, these people should be motivated. They should be made aware that, I mean, after the age of 40, I would say like even females, males, equally, they should go for a basic lipid profile testing. And if you are at a genetic predisposition, like your family history is there, heart diseases, and at least then even at an early age, you can go for a lipid profile testing. Even kids right now, nowadays, even
Mm.
children, when I feel if they are suffering from obesity, so another like disorders, diabetic, even diabetes in young individual or even in older individual, they are at
Right.
a very high risk. They should be motivated to go for a basic lipid profile testing because it's just a hardly a 5 ml sample. And rest is taken care by the laboratory. The laboratory who is doing the test, and if like you said, we've been using the best reagents, which have been proven in the studies, in the latest studies, that these are the best reagents right now. So that also really matters. If that, I mean, lab has been doing their jobs correctly, then we are diagnosing the patients, and we're diagnosing the even though we don't miss those patients, which are being missed by due to certain faulty reagents or faulty, errors while conducting the lab studies. So I feel, I mean, the most important is educating people, telling them that yes, you are at a high risk, go for this test, and this it hardly take. I mean, I'm sure they are spending more money on other things, and if they can spend just on a basic lipid profile testing, it's nothing. It's
Right.
nothing in
Right.
the other activities they're spending. And people should be made aware, especially that what are the risk factors, especially, people who have been smoking cigarettes, who have been consuming
Mm.
alcohol, people who are diabetics, then I told you obesity, who have a unhealthy sedentary lifestyle, a lot of sitting, doing a lot of sitting job, and there's very less activity throughout the week. Then I feel those people should be motivated to go for a basic lipid profile testing. Even
Right.
if we can, start off with an initiative like door-to-door testing, something like that. I
Mm.
mean, I don't say
Screening.
be
Yeah.
conducted free, but door-to-door, going and
Right.
conducting tests and taking samples. Maybe that can also help with this, identifying those
True.
individuals and, decreasing the
Mm.
burden of cardiovascular diseases in our country.
True. True. So yes. So yeah, getting those high risk individuals, and there's also like a questionnaire prepared, by the Cardiovascular Society of India, which can identify these high risk individuals under the age of 40. Because with 1 in 5 heart attacks are happening in people with below the age of 40. So these high risk individuals is extremely important for them to get treated. And the latest recommendation of the Cardiologist Society of India, that is the CSI, is lipid profile testing should be starting at the age of 18 with non-fasting measurement. Further stresses this fact. So with this challenge, and I hope that we continue to take this pledge as we are in the healthcare industry and as a diagnostic company, as a clinician from you, I we take this pledge to initiate more health programs and increase awareness of healthcare in India. So thank you for joining us and
And one more suggestion,
helping us in the
nowadays,
pledge.
yeah.
Yes,
So
yes,
nowadays is the day of, like people you use a lot of Instagram. So I feel that you can even
yes,
influencers, you can just give influencers this. Yeah, I mean I think that's a
yes,
good idea.
yes.
Just
It's a very
creating
good
a
idea.
influencers. People follow those influencers
Yeah.
blindly and they want to use their cosmetic products. So why not just tell them to do what
Why not?
cycle of testing is required?
Actually, you're absolutely right because the World Heart Foundation has actually created a kit for influencers for Instagram and TikTok. So
Correct.
you're right, and so this is being used outside India. We should also start using in India and start creating awareness using these Instagram, social media, because now most of the people are online, especially the younger generation, like who we are talking about, like 1 in 5 people get heart attack below the age of 40. They all are online, so it'll be a great way to create awareness through that. So we will put the snips of your videos on Instagram and try
Sure.
to influence people.
Yeah.
Yeah. So thank you. So with that, any questions quickly, or since we're a little bit out of time, if we have anything, Dipti, or you can close with the World Health Pledge.
Yeah, so anybody has any question want to ask Dr. Nitika? Anything about lipid management, any testing?
Yes, Dr. Shankara, you had a question.
Yeah, So thank you very much for the wonderful presentation. So it was really thought provoking. So I basically had, my question was on how do you think this, see, now lipid profile is for the current trend, which has to happen. Like what you said, even above 35, it has to start. So what do you think about this troponin I also? So that is also a booming thing for, early disease diagnostics. So do you think that will also help?
See, if I feel this is where, I mean, like basic symptom of uneasiness is there. Like if you feel that there's some kind of, if you're having this problem, like kind of a pain in the chest area, okay? If you feel there's a kind of stabbing pain or even a discomfort, a little discomfort you find in the chest area, right side, left side, or even in this upper part of the stomach, or even going to the shoulder on the left side. So that in that case, definitely I feel troponin test should be done because just to rule out that any MI has happened or base. So those individuals should definitely go for that. But I'm not sure whether regularly, I mean, people who are going for lipid profile would like to add on for a troponin test. But definitely, it's a good idea. But I would feel if a minor symptom is there, definitely you should add on this test.
Yeah, thank you very much.
Yes. So we can just take one more question if anybody has, and then we can close. Yes, Dipti.
Yeah, anyone has any question? So Dr. Nitika, I have one question.
Yeah, sure.
So, I want to understand that how like a LDL measurement, because generally what happens that the most of the formulas are being used for lipid management where LDL is not involved, like it's not a regular routine test has been considered. So, do you think we should consider LDL as a regular parameter for lipid management?
Yeah, definitely. I mean, see, VLDL is considered not to be very I mean, it's not considered to be very particular for like heart disease because in VLDL we have a lot of variations happening if the patient is fasting and whether he has had the meal. I mean, so it varies. The VLDL varies according to that, and there is also certain problems with the enzymes in the lipid profile metabolism. So VLDL is not very accurate in that, but definitely LDL, if it's on a rise and HDL is on a lower side, so it is a major risk factor for cardiovascular disorder. So definitely those patients, I mean, getting a complete lipid profile is important. Then only you can assess that yeah, this patient has a risk of impending cardiovascular disease. And nowadays, I feel, I don't know if you guys, I mean, BNP is also there. That is for cardiac failure,
Yes.
right? That is also a very important parameter. So if you want to consider cardiac failure, so BNP is a very important test as well.
Thank you.
Yeah. Well,
I think then we'll end the session. So
Dipti,
yeah,
Dipti, I just have one question for Madam. So,
yes.
Madam, I'm getting some of the queries regarding the customer side, especially for borderline samples. Like if ADL borderline sample is 150 to 160. So in that case, the accuracy of the result will be vary company to company. Means like CQC is giving 150 and the other company is giving 170 and 180. So that time is a customer concern is that which value is correct and how doctors see this in this scenario.
yeah, that's very true. I mean, that many times patient comes to us, to a clinic and they present to us with 2, 3 tests from various labs and they said, see, this in this lab we're getting this much value, in this lab we're getting this much value. So what is the right value? What should we do about it? Whether should we start a medicine or what? I mean, they are concerned and they are a little scared also. So I feel, I mean, a doctor, that's what, I mean, in the doctors, if they're well read about these studies and they know which reagent the lab is using, they can have a discussion. I'm not, because on the report, it's not mentioned which reagent it has been used, and what has been used. So they can have a word with the lab, and they should also, go through the different studies and they should know what is the best reagent being used and then have a word with lab. And then, because many times we also get like various other tests are being done for many other problems in ENT. So we always have a discussion with the lab people, even if an ultrasound is done in patient, we have a discussion with the radiologist and the lab people that who has done the test and what does he feel. So similarly, in case of these investigations, we should know which reagent the lab has used. And like that's why we had a big discussion about it here that CQC reagent is the best one right now, and your lab has been using that. So if we know that, okay, this kind of reagent is being used and this has this much of credibility, and then yes, we know that, okay, this report is more credible as compared to the other one. And then that's how we can tell the patient in his or her language that yes, this report is the better report and we should follow this report. This is what I feel.
Thank you. Thank you for your answer.
Thank you. Thank you, Dr. Nitika. So before we close, I want to share one video. 1 minute, I'll just share it.